Have you ever found yourself anxiously awaiting a life-changing answer? The 2-week wait is a test of patience and emotional resilience. By the time you reach 12 days past ovulation, or 12 DPO, the anticipation peaks. Many choose this day to take a home pregnancy test, holding their breath for those life-changing lines. 12 DPO is crucial because your body has produced more of the pregnancy hormone, HCG. This hormone becomes the focus of your pregnancy test results. Testing at this time is usually more reliable. You might see a positive, a faint line, or a negative result. However, understanding your symptoms and test outcomes is vital in this moment of truth. At 12 DPO, HCG is the main player. This hormone is made after the embryo implants in the uterus. Implantation generally happens between 6 to 12 DPO. By 12 DPO, for most successful pregnancies, your body has ramped up HCG production. Therefore, sensitive early detection tests show accurate results. A positive test at 12 DPO, even with a faint line, strongly suggests pregnancy. The faint line indicates HCG is present but at lower levels. These levels typically double every 48 to 72 hours. However, a negative test doesn't mean the end. Late implantation or lower HCG production might result in a negative reading. Now, let's explore the symptoms you might experience at 12 DPO. Interpreting these signals can be confusing. Early pregnancy symptoms often mimic those of premenstrual syndrome, largely due to progesterone's effects. Common symptoms at 12 DPO include mild cramping. Light cramps may indicate implantation. Spotting. This can be light pink or brown, and is much lighter than a period. Breast tenderness. Hormonal changes can cause heavy or sensitive breasts. Fatigue. Unusual tiredness may arise due to increased progesterone. Nausea or food aversions. Early signs may include mild queasiness or heightened smell sensitivity. Bloating and mood swings, classic PMS symptoms, or signs of early pregnancy. Because symptoms can overlap, it's best to combine them with test results to interpret your situation accurately. What should you do next? If you have a positive test at 12 DPO, consider a few steps. First, reconfirm your pregnancy. Even a faint line is a positive result. Retesting in 48 hours can show a darkening line. Next, schedule your first prenatal appointment to confirm with your healthcare provider. Start prenatal care by taking a prenatal vitamin containing at least 400 micrograms of folic acid, as recommended by health guidelines. It's also wise to avoid alcohol, smoking, or certain medications for a healthy pregnancy journey. Conversely, if you have a negative test, don't lose hope. A negative result isn't always definitive. Late implantation or HCG levels may not be high enough. Wait a few days and retest using your first morning urine for the best results. Monitor your cycle closely. If your period is late after negative tests, consult your healthcare provider for guidance. Blood tests are more sensitive than home tests for confirming pregnancy status. Let's address some common questions. How accurate is a test at 12 DPO? It's considered quite accurate, especially with sensitive, early detection tests. However, false negatives can occur, so retesting if your period doesn't arrive is worthwhile. If you experience symptoms but have a negative test, you're not out yet. Learn to distinguish between PMS and early pregnancy signals. If your period is significantly late and tests remain negative, Reach out for medical advice. This stage can be emotionally intense. Whether receiving a positive or negative, the feelings can be overwhelming. Self-care is essential during this period. Lean on your support system and engage in relaxing activities to manage stress. At 12 DPO, you are one step closer to knowing. A positive result may signal a new beginning, while a negative can remind you to be patient. Listen to your body and trust the process. If you enjoyed this video, please like and subscribe to our channel for more insights. Remember, your journey is unique, and you possess the strength to navigate it.